The menopause. The menopause is an inevitable stage of a woman's life, which can occur naturally or be brought on by medical interventions, for example surgery for cancer, or can be an intersectional issue for transgender individuals. However, it should be recognised that the experience will vary significantly for individuals, and this will need to be reflected in a force's organisational management and support. As at the 31st of March 2019, there were 37,428 female police officers in the 43 police forces in England and Wales, comprising 30% of the total, with women aged over 45 making up around one-third of the total. In relation to police support staff, as of March 2018, 61% were female, and as the average age of our workforce increases, there needs to be a better understanding of the impact it has on themselves, their families and their workplace, as the menopause is still not often talked about publicly. By identifying symptoms of the menopause, there's a genuine possibility of supporting an individual and preventing absence if the symptoms are recognised. Encouraging and allowing the individual to talk freely about their situation with their line manager or another supportive individual. For example, many forces have a local menopause action group, which can be an excellent source of advice and guidance to both individuals and their supervisors. Women often feel insecure and self-conscious about their abilities in the workplace, and identifying ways in which they can overcome these can greatly assist in building their confidence. We all have an obligation to ensure the health, safety and well-being of staff, and, when appropriate, carry out risk assessments which could include women going through the menopause. This guidance aims to assist you in understanding the menopause and how it may affect staff by explaining more about what the menopause is, and suggesting ways in which you can provide support. Women in the UK normally go through the menopause between the ages of 45 and 55, the average age being 51. In rare cases, some women experience the menopause before they reach 45, possibly due to surgical intervention, such as treatments for some cancers. Every woman experiences the menopause differently. Symptoms vary and range from mild to severe. Although it's generally called the menopause, the phase when symptoms mainly occur is actually called the perimenopause. Perimenopause may last from a few months or a number of years, although the average is 4 years. When it's been a year since the woman's last period, then she is said to be through the menopause or postmenopausal. Symptoms may include hot flushes, night sweats, trouble sleeping at night, forgetfulness or trouble focusing, often linked to not sleeping, mood changes which can be mistaken for depression, anxiety, migraines, headaches, palpitations, loss of confidence, forgetfulness, digestive problems, and the need for more toilet breaks. This is not an exhaustive list, and symptoms may vary considerably in duration as well as intensity for the individual. If you consider that you or a colleague might be experiencing menopausal symptoms, then advice and guidance should be sought from a medical practitioner. Dependent on the diagnosis, one or a number of different prescribed interventions may be offered. The main treatment for menopausal symptoms is hormone replacement treatment, HRT. Other treatments are also available if someone does not wish to take HRT or if they're unable to take HRT. GPs will be able to advise on the treatment options available, taking into account symptoms and medical history. Non-prescription interventions may also help. Making simple dietary and lifestyle changes can often improve menopausal symptoms. You should treat staff with respect and understanding when discussing concerns in relation to the menopause, in the same way as you would with other medical conditions when applying performance management and sickness absence procedures. The way in which issues relating to the menopause are dealt with in the workplace can have a major impact on a woman's health and well-being. If menopausal symptoms result in a physical or mental impairment that has a substantial and long-term negative effect, then it can be classed as a disability and should be managed as such. A disability is defined by the Equality Act 2010 as a physical or mental impairment which has a substantial and long-term adverse effect on the ability to carry out normal day-to-day activities. Long-term means the impairment has lasted at least 12 months or that it's likely to last 12 months. The ability to be able to talk about very sensitive issues is an important part of effective management. The ACAS Guide to Having Crucial Conversations provides some good tips on having these types of conversations. Managers should understand that adjustments may be necessary to support women who are going through the menopause, whatever their role, officers or support staff. We have a duty not to discriminate against individuals under the 2010 Equality Act. The emphasis is on support. It's important that you take time to discuss with the individuals what is best for them and explore potential adjustments. Remember that menopause is not an illness, but a phase in a woman's life. With support in place, most women can continue to come to work and perform their roles successfully. Local force policy or guidance on the menopause, flexible working, reasonable adjustments, attendance management, health and safety, and established well-being practices at work should be followed. If specific advice is required, managers or individuals experiencing symptoms of the menopause can speak with their HR team and/or occupational health advisors. Additional support or advice may also be available from staff associations, including federation and trade union representatives, and reputable websites.